Body butter, body butter. I'm Malika Battle Butter. We have a dilemma, family. We got a real dilemma here. I'm out of body butter. What to do, what to do. We about to start the show. We talking about the healthcare system today. See you there. Well, those that's been following, y'all know that I've already started the fast, right? 21 days, we shooting forward, man, right? So it's day 2. So I'm coming a little bit differently with the folk tales. I'm gonna pull a folk tale from the African folk tale book. This is African folk tales by Roger D. Abrams. It's Abrahams. It's actually Abrahams. Selected and retold by him. I'm gonna have to go through and I'm gonna pick one and I'm gonna work on that one for a couple of days. Right? The proverb that I'm working on personally is say the knowledge holder, the best life is achieved by engagement with systematic process. The best life is built on systematic use of life-giving principles. That's kind of the proverb that pushed me towards doing this fast, right? So I'm gonna work with that proverb for a few more days. Then I move on. I'm using the African openings to the Tree of Life, and other than that, I use the gye-nyame Journey handbook. You know what I'm saying, as well, because I got a bunch of proverbs selected in there. I'm using my Induce Cyber Challenge sheet, but I'm using it to show y'all, right? And I'm filling it out, but I'm actually doing all my reporting on my on my gum.co/GNJ updates, right? So those of you that want to keep up with the struggle, keep up with what I'm going through, you know what I'm saying? You need to check into that site, right? So I'm packing up right now. I'm on my way out of town, so we will be doing this from a different location tomorrow morning, right? But you know what I'm saying? We still gonna have the same energy. We still gonna have our ambrosia because I got ambrosia to travel with. You know what I'm saying? But family, this healthcare bill has really got me perplexed. I mean, I after looking at the research on the microbiome, after looking at the research on black seed oil, after looking at the health benefits of bitters, after looking at the health benefits of of that ambrosia and kombuchas and junes, and looking at the health benefits of a whole diet, a real diet, right? I can't help but to be frustrated by these talks that I'm hearing as far as the government trying to save money on healthcare, when in fact that is not supporting a healthcare system. What we are supporting is a sick care system. We have a diet, the standard American diet, who I learned from my brother. I can't remember his name. Well, anyway, he called it sad. You know what I'm saying? We have a sad diet, right? That causes us to fall ill, which causes us to go to the doctor, which causes us to take maintenance drugs, which causes us to get even sicker, which causes us to get even sicker, which causes us to get even sicker, which causes us to forget who we are, which causes us to forget to breathe, which causes us to die in pain and agony. Family, it is apparently clear just from the short time that we have been doing the little bit of research and building the 21 day and yep, you helped me build the 21 day and Cyber Challenge, because when we started this, right, those of you that's been tuning in, when we started this, it was just about changing the days of the week. But it didn't make no sense just to change the days of the week and not change the other aspects. We are already working on the thinking. Why not work on changing the intuition? Why not work on changing the emotions? Why not working on changing the spiritual? And why not work on changing the physical? Why not totally change so that we can change the reality in which we deal with? Right? Family, we got to get up out this sick care shit. See, because what's going on is, because let me tell you the hustle. Right? I get you to work for you, work for me the whole life. Not, well, actually, let me paint a different picture for you. A historical picture that my elders used to paint for me when we used to sit around in our classes. Yep, Brother Hatim used to sit around in classes with elders, and they would tell us stories about how um, captives, you know what I'm saying? I don't like using the term slave, right? Captives will be out, will be aging, right? And once they got to a certain age and they outlived their usefulness, the master would let them go. You know what I'm saying? The master would give them a cabin out in the woods so that they could die all alone by themselves, right? Sick from the food and broke down from the work and the stress. They would march them out into the woods and be like, Cephas, I'm letting you go. You're free. Cephas have to get out there and get it on his own. Cephas would live a horrible existence. Why? Because Cephas is separated from the group in which he struggled with. Cephas is out in the woods all alone, and he never have probably ever been alone because they used to all sleep together. They used to eat together. So now Cephas is out in the woods struggling. So this slaver, this white man worked him for his whole life. And when he was no longer useful, he moved him out to the woods to die alone, out the way. And he would give him a little parcel of food, but it would be, you know what I'm saying? And Cephas would stay out there suffering and die because he was too old to run. Right? Now, that's how our healthcare system works. That's how this system works. You go out and you make money, you earn, you produce every day of your life. You on the hustle, you on the grind, you working for your corporation, you working for your company, right? You struggling for others, you making other people rich, and when you retire, they give you a pittance, give you the little bit of money you got saved up, and then all the money they've been taking from Social Security, and they let you go off into the sunset. Not realizing that all the hustling, all the grinding, all the hustling, all the stress, all has left you just like Cephas, broken down. All of the food that they gave you, because it's culturally inappropriate, all the food that they exposed to you. See, unlike Cephas, you had a choice, and you believe that choice is your blessing, right? But let me tell you something, family, and you really need to think about this, right? When you look at all the cultures that live a long time, all when they could talk about the Greek diets and they go to these Okinawa and they look at these people's diet, these people's diet don't vary that much, family. They're eating food that is culturally appropriate. They're eating food that connects them with the land. They're eating food that connects them with their culture. They're eating food that connects them with their ancestors. And it's not a big variety, family. If I'm wrong, check me. If I'm wrong, write down below, check me. Because like I said, I do this freestyle. Right? I read to y'all, but I take the stuff and I go. But when I'm on one like I am this morning, I do a freestyle. So you done ate your way and worked your way and stressed your way to ill health. Now check out the hustle. This whole time I've been taking taxes from you. Right? And then I give you your Social Security and I take taxes from that. Right? And then on top of that, when you get sick, you go back into another part of my system and I overcharge you for your care. And what's even doper, I give you medicine. The hustle, the all-time hustle. You know why? Because there is no cure. Or at least they tell you there's no cure. We can only help you maintain. We can't get rid of the sickness. Family, we got to get up out that loop. Because what happens is that all of the savings... See, I tell you often about my grandfather, right? But I don't tell you the other part of the story, right? In order for my grandfather to even get the medical assistance, because his pension couldn't afford the medical assistance that he needed, he couldn't really afford it, right? He had to get rid of his pension, and he had to get rid of his house, and he had to basically take himself to a level of a pauper so that he could be able to receive the services that he deserved. He worked his whole goddamn life. He took care of his family, and his pension could not afford the price of the fucking care that it was supposed to take care of him. Do y'all understand me? So you work your whole life and you got to give that shit right back. You got to give your house back. You have no inheritance for your children. So family, we got to come up out of that. We got to come up out of that. You know what I'm saying? Some of y'all partying. I mean, and every meal is a party. Every meal, you eating different shit. Culturally inappropriate. Right? And I'm not just talking to my African family. I'm not just talking to my black family. I'm not just talking to my African American family. I'm talking to even some of y'all, some of the West Asians that be listening. Because I know some of y'all listening. Listen to me. Culturally appropriate diets. Culturally appropriate foods. Culturally appropriate actions. Culturally appropriate liquids. Culturally appropriate behaviors. Right? We all are caught into a system where medical care is sold as a commodity. I need y'all to hear me. Medical care is sold as a commodity at a premium price. Why would I want to heal you? You financing my car. Why do I want to heal you? You financing my house. I benefit nothing from you getting better. I get a good conscience, but I can't get the new car. We have a sick care system, family. SCS, a sick care system, where it feeds upon itself. It feeds on the fact that it needs you to be unhealthy for it to work. You have to be sick for it to work. You have to be sick before you plug into it. Family, what I'm saying to you right now is, right, gye-nyame is providing you with a healthcare system, right? We're doing the preventive maintenance. See, in the military, this is what they used to. We used to do PMCSs. We used to have to do preventive maintenance care and service on the Jeeps. We have to do preventative maintenance care and services on our gun. We had to do PMCS, and I'm suggesting that you start doing PMCS on yourself, so that you don't have to get to a point where you're broke down, and when you go to the doctor, it's gonna cost you $100,000. It's gonna cost you your retirement. It's gonna cost you to bankrupt yourself and to cripple your family. You know what I'm saying? Do you know how crippling it is for you to have to go through? Do you know how crippling it will be, and how devastating it will be for your children to have to walk you through dementia? When I just got done talking to y'all about the microbiome, and how by adjusting our diets and dealing with the gut flora and the microbiome that's part of our existence, we can heal, or we can take care of almost any issue. You want that burger? Dude, listen, I don't care about you eating the hamburger. I don't care about you eating the pork. I don't care about you eating that shit. But are you eating quality? Are you, see, because think about this. You are I'm gonna do a whole session of you are a processed being. You are a processed being, eating processed food. Even your meat is processed. That beef you eating right now, is that beef? Family, is that beef? Think about it. Is that beef eating what beef is supposed to eat? Is it eating actual cow food? You know what I'm saying? Because the oats and shit that they feeding the cow is not natural cow food. Cows eat grass. That's what they're supposed to be eating. You know what I'm saying? What the chicken's supposed to be eating. Because if they're not eating their diet, they're not eating, because even chickens and cow, they got culture. Cow got a culture. Are they eating culturally appropriate foods so that their body can produce the microbiome? They have microbiomes that is best for that cow, so that when you eating that cow, you can get the best from that cow. Do you understand? Do you understand? Right? See, we're eating all this culturally inappropriate shit. We're getting sick. And we're bankrupting ourselves, and we're bankrupting our families, not just economically, but emotionally. Now, family, I'm 50. My grandfather didn't know. My grandfather was doing what he did. My grandfather ain't know about the great food switch that they made on his ass. Right? You know, because my grandfather, he loved some pork. But somewhere along the line, they made a switch. I'm just telling y'all. He loved his beef. But somewhere along the line, they made a switch on his ass. Oh, they pulled one on our elders, right? You know what I'm saying? They pulled one on our elders, right? Are you gonna let them pull it on you? Even though you know it's coming? You know what I'm saying? You know, because it's very hard to fake you out when you're looking at your vegetables. It's very hard to fool you when you are able to go to a market and really look at your vegetables. You know, not open a can. You know what I'm saying? Because that gives you what's called prebiotics, which we're going to talk about, right? Those fresh vegetables and that fresh fruit, right? And then, okay, now, I know people going to be mad at me, right? Because a lot of y'all be like, the genetically modified food. But I want somebody to tell me, as a human being, where you going to find non-genetically modified food? I'm not saying go out and buy GMO. I'm not telling you that. But I'm going to ask you, name a food that's not genetically modified. Hell, we're human beings. We genetically modified yams. Because that's not how they were. The way when I showed you my wife's yams, we genetically modified corn. We genetically modified. And then on the other hand, sometimes I have to wonder, did these plants genetically modify us? I'm just saying. You know, I mean, we grew up with a relationship with the plants, and I want you to really think about this, right? The plants needed to grow. The plants needed to multiply, just like we did. We got a symbiotic relationship. We get benefits from each other, right? So we like to think that as I was saying, we like to think that we are the intelligent ones. But the fact of the matter is, we might just be pawns in the whole cosmic game. Hell, because actually, dogs got it good. Sometimes I wonder who actually domesticated who. Shit, look at the food we eat. I actually gotta wonder who domesticated who. You know what I'm saying? We got, you know what I'm saying, corn. Never in the wilderness was as prolific as it is now. You drive shit. While I'm driving, I'm gonna see miles and miles of corn. You would have never been able to do that in the wild. Potatoes, soybeans. I'm wondering who pimping who. You know what I'm saying? But what I'm telling y'all is we need to take it back. And listen, this is a business idea for some of y'all. We need to truly become healthcare practitioners. Like with the system that I put together as far as the Nguza Saba Challenge, that's a healthcare system. You have put together a system that you practice every day. Now remember, say the knowledge holders, this African wisdom. The best life is achieved by engagement with systematic processes. The best life is built on systematic use of life-giving principles. Systematic use. If we look at what I gave you a 21-day opportunity to take time to invest in yourself and develop you a health care system. Don't depend on nobody else to develop you no health care system. Especially somebody that benefits from your sickness. I make profit off your sickness. Why would you trust me? I make profit off your sickness. So that's all I wanted to say today, fam. You know what I'm saying? Healthcare or sick care. You go and participate in the sick care system. I mean, and I know some of you already, you know what I'm saying, you already suffering, right? But what I'm saying is you can add little parts and start building your own system while you wean yourself off, right? Because I want you to just think about all of the pills that you're taking. Not just the effects that it has on your body, but just look at if each one of those pills is an ounce and you're taking 20 pills a day, right? Not an ounce. If each one of those pills is like a gram, right? You know, like a gram, right? And a gram, if I'm correct, is a thousandth of a kilo, right? You taking 20 pills a day at a gram apiece. That's 20 grams a day. Regardless of what it is. Let's not even talk about the effects that have on your body. 20 grams a day times 7 days a week is 140 grams. Times a month is 140 times 4, which is 140 times 4, 560 grams. So every 2 months, you have put a kilo of powder in your body. And in most cases, according to the SAD diet, we're not drinking enough water to even get all that stuff out. Where's all that good going? After the medicine supposedly gets into your system, where does the rest of the goop go? Because you know a lot of that shit is just carrier. It's just carrier material, right? It's material to get the medicine in you. Where does the rest of that medicine go? Where does the rest of that powder go? And some of y'all taking 30 and 50 pills a day. How can you not get sicker? Right? I'm doing this. I can see this coming out. I'm doing that. I can see that coming out. You know what I'm saying? I can see the greens that I eat come out. I can see the beans that I eat come out. I see them go in. I see them come out. How about you? So you got a simple choice: health care or sick care. And the bill that they're arguing right now, family, is about nothing but sick care. And I want you to remember that. I want you to hold on to that. I want you to think about that. Because I haven't heard nowhere mentioned. I haven't heard anything mentioned about them, anything about prevention. You know what I'm saying? I mean, there's so many preventative methods out here. There's so many things that people can do to stay healthy and live a vibrant life and not die suffering. Because when you die suffering, you cause trauma to those around you. You may injure even some of the younger people, and you get them scared of the circle of life. I would sing it, but I'd probably get sued for some type of copyright infringement or some shit. You know what I'm saying? So, yo, this is Brother Hot Tim saying peace. Thank you for joining me. I'm promising you, we're going to get to the third eye shit. I promise. I promise. I promise. Peace. Thank you for watching the video. I want you to subscribe. Click the bird right there, the fiery bird. And I also have a special video just for you, right there. And for those that want more information about gye-nyame Journey, go to our site. It should be right about there.